the best predictor of whether they went back to work or not wasn't the clinical intervention. It was, did you call them? And did your supervisor call them and say, look, we're anxious for you to get back to work. We really care about you. Come back. As a famous Boeing study. There were a bunch of other studies we did in the military that really showed that the predictors were psychosocial issues, not clinical issues. And so what are those non-clinical factors of success that impact outcome? Listening, communication, connectivity, peak end effect, all kinds of loss aversion, and all kinds of other things that we could train our practitioners that would influence. And that became known as call to care, which is the whole notion that you could take these non-clinical factors and objectify them enough to teach clinicians and then have an impact on your practice. Those are the three things we integrated from a human capital standpoint. Now, what are the benefits of it? You talk about marketing. We love your product. It's a terrific product. I wish that I had that a few years ago. But what we found is that the best predictor of future patients is your current patients. And if they are comfortable in your environment, in fact, in dentistry, one of the ironies I found about dentistry, completely different than healthcare, is dentistry is so much more transactional. I didn't experience that as a physical therapist and in primary care and occupational health. It was a relationship driven. So one of the areas we've really focused on is how can we drive our transaction-oriented patients, the ones who come from ZocDoc, the ones who come from all these other lead-generating funnel machines, and turn them from a lead to a patient, to a friend, to an ambassador who refers their friends and family. And the combination of friends, family, former patients, I found that in healthcare, I can drive 33% of our new patients through that factor. And in dentistry, we're seeing the same thing.